So, welcome, dear all. In this module, it's been a great pleasure and honor, as well as a joy to speak with Dr. Shubham Pareek because he has scored the second rank in NEET SS exam. So, congratulations to you, Dr. Shubham, from
Thank you, bro.
myself and also from all the team. And also, you have made everyone proud. So,
Thank you.
so can you tell me a little bit about yourself?
So basically, I'm from Rajasthan, sir. I have done my schooling and all everything from Rajasthan itself, and
Okay,
my UG was from R&T Medical College in
okay,
Udaipur, and
okay.
my PG was from Sir Gangaram Hospital, Delhi.
Hmm.
Then I finished my PG in 2023, and then I gave NEET 2023, in which I scored rank 74.
Okay,
So I had to prepare. I had another year for me. And
okay.
then I joined Sharda Medical College in Noida. Then I started
So, you were
preparing.
working as a pulmonologist there for the last 1 year.
Last 1 year, sir, I was in critical care and emergency medicine.
Oh, oh, oh. So it was a hectic job, right? Night
Not too much,
duties and
not too much, but yeah,
okay,
I got time to study. Yeah.
okay, okay. And you quit that 3 months back, a couple of months back before the exam,
Yes, sir. About 3 months
okay,
back, I had quit the job.
and dedicated the full maximum time to the exam.
Yes, sir.
Did you ever expect us after going through the questions? Did you ever expect a good rank like this?
Sir, to be honest, no, sir.
So once
Obviously, I
after
got.
the exam, you have a satisfaction to your own after going through the exam that
First,
most
sir, I
of the
was
questions
really.
were
Yeah.
okay, okay, okay.
Questions actually were around what you had taught in the videos and the lectures. So I was
Okay.
very happy that some of the questions were at least seen by me in the modules or in tests or
Okay.
GTs. Or
Okay. So some familiarity you could identify.
of course, sir, of course.
Okay. Actually, I want to speak with all the candidates who scored good ranks, medium ranks, or even bad ranks. But due to the constraints of the time and also for practical purpose, we usually speak with the first, second, or third, or maximum the initial few ranks. The
Yes, sir.
purpose of this interview is just to not just to congratulate you. That is one part. Another part is to make this video how much useful to those who are trying next time or after next year like that, so we will focus on that area.
Of course, sir.
So you told that you were working initially and then you quit this job and dedicated the maximum time to this. So
Yes, sir.
did you feel any starting trouble because there was a 1 year gap in between the DNB exam?
There is, it's always difficult to begin, but
Okay.
once I began, it was getting simple day by day.
So the most important thing is to start. So
Yes, sir.
if someone has completed the DNB or MD, then there is a gap, some working or some other job, and then trying for the DM exam. Where should he begin and how should he begin?
So, for a couple of days, one should start gathering all the text, all the books, all the videos, everything there is.
Sources. Okay.
Sources, yes, sir. So, this should be done for at least a couple of days. And
Okay.
then they should begin with easy topics, in my opinion, like
Correct.
short topics like PAP and PAVM, like that.
Yeah, yeah. So that will give you a start, right?
Yes, sir.
Okay. And how much time or how many months is actually required? Is 1 year enough or 6 months enough, 3 months enough? Any idea regarding that?
Sir, I would say six
I
months
know that it varies upon the individual candidate, but to be an average,
it does, sir. Actually, I would say about 6 months are more than enough.
more
If you
than enough.
dedicate your time to it, yes, sir.
Okay. So someone can work and prepare at the same time, according to your opinion.
They can, but they would need a couple of months at the later stages, just before
So
the exam.
from your experience, it will be better to get the maximum time or quit the job by at least 2, 3 months prior to the exam if you are
Yes, sir.
seriously planning for the exam.
I would suggest so. Yes, sir.
Okay. So that's about the beginning. So once you start, how was your preparation and which all resources did you use?
Okay, so what I did was, sir, I had completed at least one reading of Fishman in my PG days.
Okay.
So, but then meanwhile, the edition got renewed. the
Yeah,
sixth
yeah,
edition came out. So as I started preparing for the exam, I took the Marrow first. I mean the lecture series. So I
okay,
watched all the videos,
okay,
and side by side I was reading Fishman as well. And
okay,
some, I would say, the tables, flowcharts. I was always studying from Murray as well.
okay,
So that was it. So
okay.
Marrow's videos were very helpful, and
Oh, thank you.
sir. So that's about it, sir.
Any mnemonic or any kind of shortcuts which we have discussed come to use?
Sir, I can't pinpoint any such mnemonic, but yes, I loved all of them, sir. Your mnemonics and your way of making things easier to learn, easier to understand is just on another level, sir.
Okay. So, any specific area which you got maximum benefit, like if there are some modules which are related to the guidelines, some to the important topics like communicable pneumonia or lung cancer, effusion, pneumothorax, any specific modules which you got maximum benefit, like,
Sir, not in the priority, I would say, but uh, NTM was a very good module, and then IPAF was a really good module.
okay,
Same with the connective tissue disease as well, and community acquired pneumonia also.
okay. So, how was the high yield videos? Have you gone through it?
Sir, not really, sir.
Okay.
Not really. I did not see.
That was released right before the exam,
It was
so it's
released.
available
Yes.
right now. Which
Yes.
in which we are planning to cover the entire topics in short period of time, so as to save the time for you just before the exam. Actually,
Right.
did you try the mock test?
I did, sir. I was
Okay.
regularly giving the grand tests, and I also solved the modules. I mean, the question modules as well.
Okay. So that helps in what way?
Sir, first to manage time,
Okay.
and I would say because once you read the subject as a whole, you get to recall all the questions and topics.
Correct.
So that was, I think, in my opinion, the most helpful.
Okay. And did it help in assessing the time management?
It did, sir, but I would like to add a point. Actually, this year they changed the format completely. They
Yeah,
divided
yeah.
the
Can you
exam.
explain it for the candidates?
Okay, so there are total 150 questions in the exam,
Yeah.
which we have to solve in 150 minutes. What they did was they divided the 150 questions in three sections of 50 questions each
Mhm.
and
Mhm.
50 minutes each.
Okay.
So before completion of 50 minutes for each section, you cannot go to the next section.
Correct.
And once
And you
you
cannot
proceed
come back also.
back also, yes, sir.
Okay.
So that was a
So,
little,
in your opinion, is it good or bad that this kind of division and all?
sir, it was not good, I would say, because there
Yeah.
are some questions which require a certain amount of time, so we cannot come back to
Correct.
it. But then there were questions which were like for solvable in like 5 seconds, 6 seconds, so we cannot use that time in the
Yeah.
larger, bigger questions.
Okay. And any particular area that comes in first 50 or the second 50 is of different type, anything
Not
like
really,
that? Is
not
it
really.
just mixed at all? Mixed.
It's mixed, yeah. But
Mixed.
what I saw was in the second set, the questions were a little bigger or had more text to it, so it took a
Okay.
lot of time to read.
So in 150 questions, how many were case based or case scenario based? How many were concept or fact based? Like that. Can you recollect?
Most of the questions were fact based. I would say around 70%, 60% were fact based.
So if you know it, you can answer. If you
Yes,
don't
sir.
know, you can leave like that.
But they were
Case
straight
based. Which one?
all the fact questions were straight from the books.
Okay,
So
okay,
if you have read it, you know it.
okay. And any images, CT, X-ray images or
There was
pathology image, like
there were, I think, 5 to 10 questions of images. I think there was hepatic hydrothorax and one ILD also, if I'm not wrong.
which one? Hepatic hydrothorax and
ILD, sir. It was RAILD.
was it a CT?
It was, sir, I'm not able to recollect actually. I just
And
remember the question.
what was the image for hepatic hydrothorax?
It was an X-ray, sir, and which showed
Oh,
right
effusion.
margin. effusion. Yes, sir.
Oh, then that image doesn't matter that much, right? You can easily pick out the effusion from X-ray. Okay.
Yes, sir.
And they're related to a particular situation regarding chronic liver disease or like that. Okay.
Yes, sir.
So totally
There was
five
one
to ten
from
images.
ventilator also, sir. Sorry, I'm interrupting, sir.
No problem.
There was one
So
from ventilator as well, which showed auto peep. So that was
oh,
also
okay, okay. So 5 to 10 images were there.
there was, sir.
Oh, okay, okay, okay. Any questions from critical care? You told one
Uh,
about the ventilator
there were
or topic.
about two or three questions regarding what is
Only that
the
much.
yeah, from about ventilator itself, sir. But
Okay.
those were just from superficial critical care, not very deep.
Yeah, yeah, yeah. Not deep. So the idea that we get is that if you are intending for DM Pulmo, what you have to learn is core pulmonology itself. That will
Yes,
serve
sir.
the purpose. So how many questions did you attempt?
Sir, I attempted 147.
Only three left.
Only three left. Yes, sir.
And in around 50-50 scenarios, you try to take the chance.
Sir, even if I was able to, you know, get one option out, I had to attempt that. I just
Yeah.
made up.
Okay. And that is, you have to take that risk.
Yes, sir.
Okay. You were able to complete it in time. The first
Yes, sir.
50 questions were covered in how
First
much
50
time?
questions were easy, sir. Very easy.
Okay.
But the second set, I would say, took a little bit of time. I just completed in the 50
Okay.
minutes we were given.
If you are not able to complete, then automatically will it go to the session 3?
It does, sir. It
Okay.
automatically locks the set and you go to the next section.
Okay. So you can see from the computer monitor how much time is left.
We can, sir. We can see.
And if you are not sure about a particular question, you can mark it and then go to the next question and come back.
Yes, sir. We can do this sort of thing in a particular set itself, not in the adjacent sets.
Okay. 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 So regarding the notes, how much useful it is, which is given along with the modules,
Sir, I did not
or did
get
you
that.
make your own note?
I made my own notes, sir. I made my own.
Okay. So your pattern is you will read the textbook first and then refer to the module, or you will refer the module first and then correlate with the textbook or guideline. In what
Sir,
way do you
I would
make
read.
use of the videos?
I would see the videos first and then come to the textbooks and guidelines.
Does it save time?
Sir, I don't know what it is the other way, doing the other way around, so I cannot comment on that. But yeah, it served the purpose for me.
Okay, okay. So how did it help you actually? It gives an initial idea so that you can go through the textbook easily.
Yes, sir. Well, actually,
Okay,
what you have spoken like in the lectures, every line is from Fishman, so
correct.
that helps a lot. That helps a lot,
Okay,
and the way you speak it, it makes it very simple to learn and understand.
okay, okay. So in that way it helped. Okay, great to hear that. So what are your advices to the upcoming generations?
Okay, so I would say I would just tell them to stick to the basics, sir. Read Fishman, read Murray, see all the videos at least once, twice. Read notes if you have time. Read the latest, fetch the latest guidelines and read them. All in all, I think if somebody is preparing, they have to be very sure that whatever they're reading, they have to revise it in the last 5 days before exam. So read
Correct.
just that much. You don't have to go in depth for every topic. You don't have to learn every line. This is an exam. You're going to get some questions wrong. Don't just bother yourself being a perfectionist, I would say.
Okay. So one module have you watched more than one time? Just out of my
Yes,
curiosity.
most of the modules I've watched at least twice, once or
Two
twice.
times. Oh, okay,
Yes,
okay.
sir.
And then you read the textbook, then you make the note with reference to each. Is it your way?
Yes, sir. I would add a few things in the textbook itself, whatever
Uh,
you spoke, and mark them as important whenever you say this is important in the exam.
oh,
This might come up,
then you
and
mark
then
in the textbook.
I mark in the text, and then make notes out of it.
Oh, your own notes in your own notebook.
Yes, sir.
Oh, okay, okay. And then you revise it in the last. That particular
Yes,
note
sir.
you revise.
Yes, sir. I was
Correct.
able to revise all my notes in the last 7 days, I would say.
7 days. Okay. Okay. So once again, thank you, Dr. Shubham. I hope this video might be useful to those who are watching, because a wise always learn from those who have succeeded. So Dr. Shubham is here to share his experience. Thank you so much, Dr. Shubham, for your valuable time, and wishing you the very best from the bottom of my heart, and also from Team Marrow. Wish you good luck.
Thank you, sir. I would say,
Thank
sir, I would like to give you all the credit, sir.
you. The credit goes to you, Shubham.
Sir, thank you, sir.
The teamwork always. And your
Sir,
success is my success too.
sir.
Thank
Thank
you.
you, sir.
Bye.